And that brings us to our conversation around homelessness. We're going to start with an update on the Downtown Austin Community Court. Thank you so very much. Welcoming Pete Valdez. And so, colleagues, we have a presentation about the Downtown Austin Community Court and the important work that they're doing. And then Ms. Gray is going to do a presentation on a couple areas with relationship to homelessness, to the Homeless Strategy Office. And then we'll take up our second topic of the day. But I believe we have about 10 minutes scheduled for your piece, and then about 20 minutes scheduled for the presentation piece from the Homeless Strategy Officer, from Ms. Gray, and then we have some time left for questions before we move on to our second topic. Welcome, Mr. Valdez. Thanks for coming across the river to be with us here today.
Thank you. Good afternoon, council members. There are a couple of slides at the end of Diana's PowerPoint. If you could please bring those up.
Mr. Valdez, is this the order that you would prefer, or would you rather go after Ms. Gray?
Oh, I'm fine going
Okay.
first. Yeah.
Great.
If Diana's fine with it.
I'm fine. You'll want to continue to forward. I believe it's the last 2 to 3 slides.
Thank you very much. Good afternoon. I'm here today to provide some high-level updates about the work that the Community Court is doing to serve the individuals experiencing homelessness in this community. Our intensive case management services continued through the pandemic. We have never shut down our services. So what we did do for our intensive case management is we shifted to a full-time mobile and community model. Prior to that, we were having individuals come to the office to meet with their case managers part-time, and then part-time the case managers would meet with them in the community. Now it's primarily just meeting with individuals in the community. And what that means is we've had to provide our case managers with access to city vehicles. We unfortunately only own 5 fleet vehicles, and we have 14 case managers that have to have a vehicle to be able to serve their clientele. So we've had to rent several fleet vehicles so that these individuals are able to, again, access their clientele in the community as a best practice to make it more convenient for the individuals and to engage them in the community that they belong to, but also to minimize the amount of foot traffic in the facility, so to keep people safe in respects to the COVID-19 pandemic. Again, these individuals are working from the perspective of a housing-focused and person-centered approach. And what that means is that we create treatment planning specific to the individual's needs. And so we will find the service. If we don't provide it ourselves, we will find the service that they need to help them be successful and help them acquire that long-term stability that they need to get into housing and stay in housing successfully. Currently, we have over 300 individuals on our wait list. And so as I talk through this presentation, I'll talk about some of the things we've done to address some of that wait list. Going back to the housing-focused, person-centered approach, I want to also stress the importance of prioritizing individuals that are higher acuity. So the way that we do that is we look at individuals that are suffering from mental health issues and substance use issues, but also medical issues, and who have extensive, sometimes extensive criminal histories. So we will prioritize those individuals to stabilize and get into our housing programs. And because of that, I think that also plays a role in our wait list, because we have to take from the top of that wait list, and we are getting referrals from host, for example, or even from our court operations, but mostly individuals walking in asking for services voluntarily because they've heard about the services that we provide. Speaking about walk-in services, what we refer to as triage case management is the component of our program where we provide on-the-spot services to individuals, to any individual experiencing homelessness that walks in asking for assistance. Because we have our wait list, we can't connect those individuals to a case manager, but we can provide them items such as birth certificates and IDs. We can connect them to other organizations that might have the capacity to serve them. We help them through housing navigation if that's possible. But most importantly, we connect them to documents that they're going to need long-term, like the birth certificates and IDs and Social Security cards. And so since the pandemic started, we've served at this point over 16,000 people through just the walk-in services. And that number continues to increase. It decreased a little bit when we moved to One Texas Center, briefly for about 2 weeks, but it's starting to build up again as individuals are finding us again. Again, during the pandemic, we created what we call an Emergency Solutions Grant COVID program where we serve individuals that were staying at the protective lodges and connect them to housing through this program. This program, we receive referrals through ECHO for this program, so individuals have a coordinated assessment, then they're sent to us to work to connect to that rapid rehousing. This population is really not any different than the individuals that we are serving that we identify as high acuity. These individuals are also scoring in the 11.5 range of the coordinated assessment. And because of that, they also need high levels of support from the mental health and substance use perspectives and the medical perspective as well. And they also have criminal histories. So because of that, it is taking us longer to house those individuals than was anticipated when we took them on. But we continue to work with them, and that grant and that program is funded through the end of the fiscal year. So once that funding goes away, we hope that the majority of the individuals that we're serving will be housed, but we also know because of their acuity that they're going to need to have access to support services ongoing. So we hope that through the budget process, we're able to continue funding the FY23 budget process. We're able to continue funding the individuals so that we're able to continue working with those individuals that we're housing through that program. Can you change the slide, please? As you know, the Downtown Austin Community Court is responsible for assisting individuals that are being cited for Prop B violations or statewide camping violations. And so what we're doing is, again, because we have our wait list, when an individual walks in trying to address their cases, or when they show up at the municipal court and they're transported to community courts so that they are able to connect to our social services, we connect them to our triage case management, which again is able to provide an array of services, but unfortunately we can't connect them to a case manager because we don't have those slots available. As of October 29th, there were 138 cases that were created and that are associated with the Prop B violations or statewide camping. We haven't had any arrests brought into the community court as of yet. And so we see spurts of increases of citations, but we really haven't seen a lot of movement of individuals walking in wanting to take care of those cases on their own, with the exception of those individuals that have requested trials or are working with an attorney to address those cases. Regarding our Violent Keep Safe storage program, the community court took this program over in December of last year. Austin Resource Recovery was previously providing the oversight. And since the community court took it over, we expanded our hours from 7 a.m. to 7 p.m. 7 days a week. And additionally, we were able to provide employment to 5 individuals with lived experience because of that expansion. And we were also able to increase the amount of bins that we have available to individuals that need storage in the community. This has been very helpful to individuals who have lived in encampments and who have had to leave those encampments because of Prop B and the statewide camping ban. So we've seen a huge increase in the use of the program over the last few months. Currently, we only have 49 bins available, and we're looking at ways to be able to fit more bins into that program, understanding that more people are going to need that service. And then lastly, as I mentioned before, regarding ways that we are trying to address our wait list, we have engaged in a partnership with the Downtown Austin Alliance and Integral Care. It is called the Homeless Health and Wellness Center Program. And this program is accepting referrals from the community court and host. And we are focused on, again, providing services to the high acuity individuals who are presenting with the mental health and the substance use issues, but also the medical issues, and who have, and these individuals also have criminal justice involvement. So these, through the funding between the community court and the Downtown Austin Alliance, we are able to serve an additional 100 individuals. Up to date, that program is going very well. Their approach mirrors what we do in our intensive case management program. So we are very comfortable with the work that they're doing, understanding that, again, they're addressing the high acuity needs of those individuals. And I am available for any questions.
Thank you very much, Mr. Valdez. Colleagues, what questions do you have? Councilmember Kitchen. Oh, I apologize. Councilmember Fuentes, I'll get to you.
I have several questions. Just like all of us, I want to say thank you for all the work that you all are doing. I mean, this is difficult work, and it it takes a lot of heart and a lot of perseverance, and really want to say thank you. So I have three quick questions. The Pro Lodges, so you've got one program that you're working through to help folks that were in the Pro Lodges get connected to housing, if I understood you correctly. And that is, I thought I saw it said 100 over 2 years. Is that the number of folks that were in the Pro Lodges that you all are working with, that you anticipate or you have already connected to housing? Could you explain that number to me?
So to date, and I have that statistic, we are working with 69 of the 100. We've engaged with 69 of the 100, and 47 of those 69 have been housed to date.
Okay, and when you say the 100, what is that number coming from, 100?
That was just the agreement with the grant, that we
Oh, I
would serve
see.
100
I see.
people.
Okay, and those and those 100 people are 100 people that have been, they're living in the Pro Lodges, right? And so you're working with them going from the Pro Lodges to housing, is that right?
Yes, ma'am.
Okay. Okay. And then my second question is, and I'm not sure if you are the right person that knows the answer to this, it may be Diana, but and I can ask her later. But my second question is, can you remind me what the policy is for related to Prop B? What exactly is happening with folks before they are can be arrested? In other words, I know that there is a a step process for connecting people to housing, and there's a warning period, and there's various things like that. But can you articulate, can someone articulate exactly what that process is before they end up, before at the end of that process, they might be arrested?
Yes, I would defer to Diana on
Okay.
that question.
Councilmember, would you like me to attempt to answer that now or?
The reason I was asking it is because I noticed that the community, they can, if they are arrested, they're not, they're working through the DAC, in terms of the processing for those folks. So that's why I was asking. Yes, if you could just briefly answer that, that would be great.
Sure, and certainly I think we'll want to allow for APD to chime in here or correct anything if I leave any gaps. I think the primary issue, of course, is that these are Class C misdemeanors, and our officers have committed to particularly when we're clearing an encampment of multiple people, giving notice of several days, ideally. And in most cases have been able to achieve voluntary compliance.
Okay.
And so certainly can cite without a verbal warning, but typically would give a verbal warning in addition to that sort of, education and outreach that's happening prior to that time. If someone does not, my understanding is that if someone does not vacate an area after a citation has been issued or an order has been given, they could conceivably be arrested at that time. But typically, even after a citation, individuals would be given a reasonable amount of time to then subsequently clear their items and vacate an area. And so all of those are part of the reason that you're only seeing one arrest over the course so far of full enforcement. Most of what has happened has involved voluntary compliance, a relatively small number of citations, et cetera. I think, of course, if someone is issued a citation and then they do not pay or do not arrive for a court date, there is conceivably a scenario in which they could be eligible for having a warrant issued. And I think that's where we could have Pete chime back in and make sure that I've described that adequately and what that process might look like should such an eventuality arise.
Would you like me to talk about
Yes, Pete, if you want to speak to that.
So to date, Judge Coffey has decided not to process warrants because of COVID-19. So he's thinking that sometime in January, he will resume the confirmation of warrants, which would then mean that if somebody did not show up to their court date because they received a citation, that would go through the process of giving that person time to respond. And if they did not respond after a notice was sent out, that they would then have an active warrant in their name. And at that point, if officers had a conversation with them and asked for their ID and they ran their name, it would show an active warrant and they would be arrested at that time. If the community court was open during the time of the arrest, they would bring them directly to the community court. If the community court was not open because it was in the evening or a weekend, then they would be booked into the jail and brought to community court on the next business day.
Okay. I understand at this point that has not happened.
Yes, both courts, both the municipal court and the community court, are not confirming on warrants currently because of COVID-19.
Okay. My last question, Chair, is, so you all work with intensive case management, essentially. And so can you help me understand, or just based on your experience, what would you say is helpful? In other words, what is really effective in helping getting people connected to housing? Another way to ask it is, what is it that's key to what you all are doing that works for individuals to connect them to housing? Can you tell me that based on your experience?
Yeah, I think it's several components, really. The importance of the individualized treatment planning is really something that should be a priority because that takes into consideration that person's specific needs. Therefore, we are not trying to house them into a program that isn't really best suited for them. We're going to put them in a location that is going to be the best fit. On top of that, it's important to commit to continuing to serve that individual for as long as it takes. So that is one of the key factors, I think, in what we do is that we don't have a time limit, with the exception of the grant-funded the individuals being served through grant. Through our general fund dollars, we don't have a time limit for how long we can work with that individual. And because we encounter so many individuals that are presenting with high acuity, we end up having to support them for longer periods of time. So I think that's also important, and it's also something that is very helpful for the individual, but it's something that helps us help them in that we don't have to cut them off because of our funding source. The challenge of housing, I think, is the same across the board in this community, and the market for getting people into housing makes it really difficult. It's very competitive. The housing isn't as available as we need it to be for the people that we're trying to house. It's taking a little bit longer to house individuals currently. And for us specifically, the criminal history factors are playing a huge role in that as well. So we can find ways to get around that. Oftentimes, through advocacy, utilizing the case manager is what we need to do. Sometimes we have to give larger deposits. Sometimes we have to let the landlords know that we are available 24 hours a day so that they will feel more comfortable in taking those individuals. But it's a number of things that need to happen, and they can happen so that those people can get housing. It just takes a longer period of time to get them into the housing.
Thank you very much. Councilmember Fuentes. Okay, thanks. Mr. Valdez, I have a couple of quick questions. In the 138 cases that have been referred to the DAC, are those individuals, or are some of the cases multiple cases attached to the same individuals? Yeah, and looking at the data recently, some of those are not distinct individuals. There are a few that have received repeat citations, yes. If you could, maybe at our next follow-up meeting or in subsequent communications, it would be great to know that difference. Yeah, I can provide you with a breakdown. That'd be great, thank you. And then with regard to the health and wellness program, which, I just want to thank you for getting up and running so very quickly. That was something I know you know that the Downtown Austin Alliance suggested. Councilmember Kitchen, you worked with me on that resolution, and we were able to get it funded, but in part, it was using the DAC's funding that first year, so thank you for that participation. Can you help me remember how many, I know you said there's a capacity for 100 individuals. At the time that it was brought into being in January 2021. Yes. I think you had said the wait list at that point was over 200. Can you give us some sense of what the wait list is now for those services, and how much of that 100 capacity is being utilized at this stage? Yes. I don't know the entire caseload that they're working with right now, but they are fully staffed, and they're taking on individuals fairly quickly. The wait list at that time when we started this program was probably around the same that it is today. It fluctuates between 200 and 300 people at any given time. And the reason for that is because the case manager supervisor will go in there and remove people if we're not able to make contact with them when we have a case manager available for them.
and I've said this before, with a wait list, it's really not productive for us to have a wait list, because if we're not able to serve those people when they appear before us, there are chances, it's a big chance that we're not going to be able to reconnect or re-engage with them when we do have that resource available. So it's unfortunate, but I think the wait list is a good way to show the community the need for those services.
Yeah, thank you for making that point. And just to be really clear about it, so we have anywhere on any given day, we have between 200 and 300 individuals who are experiencing homelessness who have presented or have identified themselves as in need of mental health resources and have expressed a willingness and an interest in receiving them. And we have the capacity to serve just one third of them through this program.
Correct.
And I appreciate the Downtown Austin Alliance's financial participation in this one. It was a great idea they came to the city with, and I think it helped supplement the great work that the DAC was doing already in this area. So I'm really glad to see the expansion. But the fact is, and I think this is a point our community really needs to understand, is that we still do not have it funded at a level where those services are really needed. Again, we're able as a city and as a public-private partnership to help serve about a third of the individuals who are both in need and interested in receiving those services.
Correct. Yes, thank you for that.
And who knows how many more would express that same interest if they thought they would have an ability to receive those services more quickly. So thanks for helping talk through that point. Your vehicles. So I am interested, I assume that hasn't happened yet. I know through the budget we were able to fund some permanent vehicles. Do you
Yeah,
have a timeline on those?
We are expecting an additional 4 new vehicles in this current fiscal year. So that means we can decrease the amount that we are renting. And we'll just continue doing that, again, as a way to meet the needs of the individuals that we're serving in the community.
I think Vice Chair Fuentes, you really summed up one of the reasons to continue to have these updates is we've made really significant investments, and we're always getting questions from the community about how is the city investing its resources and what are the outcomes. So that, in essence, is the reason for my follow-up question.
Sure.
What is the timeline for getting those vehicles? I think sometimes there's a real lag between when we make the budget decisions and when those purchases or those programs actually get funded. And I just appreciate you and Ms. Gray and others and ACM Hayden Howard for making sure that those investments are being made as soon as possible, because we all know the needs are great and they're immediate and they're just now. So how soon are those vehicles going to be purchased?
So the individuals that we're working with at Fleet have told us that they put a rush on those vehicles, but in my experience, it typically takes anywhere between 6 and 10 months
Wow.
to get a new vehicle.
Okay, I'll need to better understand from our purchasing department why that is, because that's a long time to continue to be leasing when we've allocated the money for a permanent vehicle. But thank you for that information. And then, just lastly, I know that the council, during the budget process, I brought forward the direction to expedite the manager's decision-making with regard to a permanent location. I know there's good work happening on that front, and I hope we'll have a report back on that really soon. Have you given some thought to satellite offices? I know that's something that you and I have spoken about, and Judge Coffey as well, about even once we have a permanent location for the DAC, which is much needed. I really appreciate what you've done with the spaces at One Texas Center, but I think having a permanent home for the individuals you serve and those who are working in that building and in those programs is really critical. Is there a long-term interest, and I don't want to put you on the spot, but let me say, I think it seems to me that there still might be a long-term need for having some satellite offices. I love the idea of having those mobile, the mobility of getting out to where individuals are who need those services from the DAC. But can you speak to the possibility of potentially having some temporary or satellite offices to deliver these services to us, especially as Austin continues to grow?
Sure. There's definitely the willingness. We are definitely willing to be at the table to talk about how we can make that work. We definitely also want to be aligned with what the bigger picture approaches are to address homelessness. So we are working closely with Diana and her team on what that big picture looks like. And but again, we are definitely willing to have that conversation and make something work.
Well, thanks very much. I think that's, colleagues, I think that would be something worth talking about among our committee at some point, along with Pete and Diana and others who would like and have expertise to offer that conversation about whether that's something we should be considering as we contemplate facility use and just program delivery. Well, thank you so very much. Just lastly, I wanted, Councilmember.
Thank you. A quick question. It was spurred by some of the comments that you made, Chair Tovo, regarding the mental health component, sharing that we're right now, given our capacity, we're only able to provide services to about a third of the individuals who've expressed needing mental health services. And I'm trying to reconcile, that metric with the significant funding that we've allocated towards the ARPA dollars, and trying to figure out what is keeping us at this time from utilizing some of those dollars to address the wait list. Is it a matter of it's in the pipeline and it'll come, later down the line, later in the year? Because I imagine, even though right now we have about 200 who would prefer to have mental health services today, that number is only going to increase as we have more of the HEAL initiative roll out, more of the encampments connected to housing. So just trying to get a little bit more detail on that. That'd be helpful.
So if I understand your question correctly, and Diana may need to help me with this one, but I think that the funding that you're referring to has really been around crisis management for people with mental health needs. What makes us different is people are presenting not necessarily in crisis, but who have a mental health diagnosis that is going unaddressed. And that without the medication and the support services, they will eventually have a crisis. But what they need is really the full wraparound, not just the mental health connection, but also oftentimes the substance use linkages, and of course, the housing.
Gotcha. That's helpful. And I think it might be, Chair Tovo, you mentioned something for the committee to talk about. And I'm wondering, as we discuss providing additional direction with some of the needs, for example, the satellite offices, that we could also provide more direction on all of the aspects of addressing and reducing homelessness, because it sounds like there is an opportunity for us to make a recommendation to the full council, considering the information that is shared during these committee meetings.
Yeah, and I have to go back and double check, but as I recall, so when we funded it through the when we did the direction in like December 2020, you had existing funding within the DAC budget to match the DAAs. And then, if I'm remembering correctly, when it came forward, when the manager's budget came forward this summer, it didn't have continued funding for that program, as I recall. And so we only were able to come up with the funding to continue it through this year and help match. It wasn't exactly a one-to-one match, but it was putting up those public dollars in response to the DAA's continued private contribution. We only were able to do that through a budget amendment I brought. And I need to double check, but it may be funded through ARPA funding. I imagine Ms. Gray remembers. We did some of the DAC's needs through ARPA funding and some through maybe general fund and maybe other blends of funding. I can't remember where we eventually landed, but I think that's part of what happened, is that we knew there was a greater need, but we were starting from zero. Unfortunately, it wasn't included in the manager's budget for continued funding.
Yeah.
Is that about right?
Yes, I think
I may be
you are
mixing up a
correct.
few of the details, but.
Yes.
That's correct. And Councilmember Fuentes, I think, 2.5 weeks ago, happily Council received the update on the spending framework on homelessness for the ARPA funds. Within that overall budget of ARPA funding for homelessness, there is a line item for mental health services, in which that funding action resides. But that means that there's another 2.6 million or so to be allocated. And one of the things, the processes that we're going through, of course, with the overall ARPA funding is looking at our solicitation process. We are, going to be accessing the input of the Homeless Response Leadership Council, which is the Continuum of Care Governance committees that are being seated literally as we speak. There will be a mental health working group there. And so we'll do a solicitation. I think that further expansion of a program like this is certainly a viable use, but we hear of other needs as well, medical detox or inpatient treatment, et cetera, which is also very, very scarce in our community for substance use disorders. And so we'll be looking at kind of that array of behavioral health need within the population of people experiencing homelessness, and look at then how we invest those resources under the ARPA spending framework.
Thank you, Ms. Gray. And I like that the investment plan that you presented to council really captures what the public investment is and what the private investment needs to be to really fully meet the needs of our community. And so this is a very good opportunity for the private sector to continue to invest and to invest more deeply, because it is such a deeply felt need. Thank you very much. I appreciate, Mr. Valdez, all of your work. I just want to underscore as we close that during COVID, when all of the city operations shifted, as you pointed out, the DAC remained open and served 15,740 individuals, or had that many visits and interactions with individuals in our community.
Yes, specifically for case management, yes.
Which is extraordinary. Thank you for all of your work, and please convey our thanks and appreciation to your staff.
Thank you for your time.
Ms. Gray, thank you for being here with us today.
Thank you, Chair, and thank you, Pete, for your partnership and all the work that the DAC staff does. So we will then go back to the beginning of the slide deck. And we have now had the update from Downtown Austin Community Court, which is the third item that you see here. And what I'll be covering briefly is a bit of an overview of the various ways in which we carried out community engagement regarding that ARPA spending framework for the city dollars, and then an update on phase 2 of the HEAL initiative. Next slide. So council asked us over the summer, when the preliminary designation of $106 million in ARPA funding was established, to do community engagement as we developed the spending framework. And so we did 3 things that spoke to that. One is that we created a survey for the Austin Homelessness Advisory Council, which is supported by the Downtown Austin Community Court staff. The Austin Homelessness Advisory Council is a council made up of people with lived expertise of homelessness, either currently homeless or previously homeless. So through August and September, we completed that survey process. We created a Speak Up survey on the city website, asking folks about their preferences and priorities around this spending. And then we had a couple of in-person, or I should say virtual in-person community engagement sessions. So this slide lays out the timing of that over August through the end of October. Next slide. I'm first going to speak a little bit to the Speak Up survey that was carried out. We had 277 responses, so fairly robust response, representation across all zip codes and council districts. We did have some overrepresentation of white as a race, and in particular, we also had underrepresentation of Hispanic white when taking ethnicity into account. However, we did have approximately equal representation of Black or African American respondents corresponding to the city population. And then another thing I'm proud of in terms of the responses that we got was that almost 18% of respondents were people who were now experiencing or had experienced homelessness in the past. Next slide. We asked folks first what their primary priorities were between shelter and crisis resources and longer-term housing. About half of respondents really wanted a balanced approach, and the other half was split with slightly more, 30% preferring investments in long-term housing and supportive services, and about 20% preferring investments in short-term crisis services. Of course, that is not just an either-or question. We can do both. And the majority of respondents overall did favor moderate or significant increases in both core housing programs like rapid rehousing and permanent supportive housing, with 75% of respondents answering in the affirmative in those categories, and 71% who favored moderate to significant increases in capital investments, so the bricks and mortar creation of new housing. Next slide. We did, however, I think, find that we had some substantial work to do in the area of communications and ongoing community engagement. This isn't wholly surprising, knowing that we are a relatively new division, but only about 25% of respondents felt like they really knew how to find accurate and timely information about our community's progress to end homelessness. And so I think it's incumbent upon us to look at our communications channels and collateral, both on the part of the city and then also guiding people to other important sources of data like ECHO, who holds the information through our homeless management information system on individuals and the outcomes of programs. Almost 80% wanted updates through webpage, email, and social media. And 70% said they would like, when asked how often they would like to have updates, said they'd like to see monthly updates. Next slide. So in addition to, as I said, to the Speak Up survey that was on the city website, we did a targeted survey to the Austin Homelessness Advisory Council members. And they identified top priorities in 3 categories. First was housing, that they really, the first priority being permanent supportive housing units, other deeply affordable housing units within the community, and tiny home communities. Food access was also a priority, so access to SNAP benefits so that they can access their own food via grocery stores and other vendors, water and food distribution to encampments, and then walk-up prepared meals. And then the third category that was important was healthcare, and the 3 items that folks identified as their top priorities in this area were medical access program enrollment, so the MAP program through Central Health, outpatient mental health services, which we've of course touched on in Downtown Austin Community Court's presentation, and also identified a need for transportation to and from medical appointments. Next slide. We had 2 virtual public meetings in October, about 5 days apart, I believe the 14th and the 19th, if I'm not mistaken. And what we heard really in those sessions thematically was an interest certainly in the resource allocation, but a real concern about the advent of full enforcement of the new or reinstated camping bans in the absence of crisis resources for people to have someplace to go or to be connected to services. Identification of gaps throughout the system and acknowledgement of the challenge we have to build capacity of our providers, and really an interest in balancing that longer term timeline of the summit plan with immediate response to what was perceived as a crisis situation. Finally, a support for additional investments in mental health and substance abuse or substance use disorder treatment. Next slide. So we did make some adjustments to the spending framework that we had drafted prior to our community engagement. And This slide shows some increases in that overall budget. And what I will say, without going too deeply line by line into the items in this slide, is that we substantially increased crisis resources and then some increases in the sort of system capacity building. And if you'll go to the next slide, we reduced, in order to do that, a bit of the spending in rapid rehousing and in capital for new development. Now, the numbers you see here are the changes, not the total amount. Rapid rehousing was reduced by 2.5 million, but I believe we still ended up with a spending framework of somewhere around 50 million for rapid rehousing. So these were changes at the margins, but in particular, did end up significantly increasing the crisis resources that we contemplated as part of the spending framework. Next slide. As we reflect on this process around ARPA and around our community engagement in general, I think that we are in the process of hiring our permanent community engagement and public information staff at present. And so as those staff members come on board, we anticipate sustained engagement through some key stakeholder groups, and those include the Homeless Response System Leadership Council. So that's the continuum of care governance, governing body. As I mentioned, we'll be seating its committees in the coming days. I think those decisions have been made and notices will be going out. And those committees and work groups are really going to provide critical on the ground feedback from the community about what's needed. We'll continue to engage with the Austin Homelessness Advisory Council, and then of course other boards and commissions throughout related to the city and to other entities within the community. We would like to hold quarterly community engagement meetings that are open, much like the ones that we held in October. And I think part of that is a recognition that while those community engagement meetings were, in terms of topic, really narrowly focused on ARPA spending, I think there was a lot of desire on the part of the attendees to generally express concerns, interest, ideas, et cetera, around homelessness. And we think we need to be doing that more regularly. And then finally, based on the input we received on the preferences of those who completed the Speak Up survey, institute regular email updates for folks who sign up for those. Next slide. And Chair Tovo, would you like me to go into the HEAL update, or would you like me to take questions on the community engagement before we do that?
Thank you for asking that question, Ms. Gray. I think if you could please go ahead and do the next segment of the presentation, and then we'll have questions all at once. We're going to need to condense the Q&A a little bit so that we can get to our next
Absolutely.
Thank you so much.
I will try to go through the slides with all haste. So as you know, HEAL was adopted in February.
You don't need to hurry. I'm just saying we're going to condense our questioning.
Sounds good. HEAL was established by council resolution in February of 2021, with generally approximately a 6-month timeline to complete the compassionate closure of 4 encampments over the course of the summer. And so we completed that in August. And then with additional funding set aside for phase 2 from ARPA funds, council directed us to begin phase 2 by November. And that also entailed us working on a longer term tool that would help us assess and select encampments for relocation. Next slide. And so we are in phase 2 now. We shared with you in our last briefing the draft of that assessment tool. So we refined that. Staff went out and essentially beta tested the tool in a couple of encampments in partnership with multiple city departments, including Austin Fire, Austin Police Department, Host, resource recovery, parks and recreation, watershed protection, and also the Travis County Constables who do homeless encampment outreach, and eventually went and assessed another 11 encampments utilizing that tool. We know, of course, that there are many, many other encampments in the city, but these were from among a battery of a list of encampments that had been identified by departmental partners as ones that were particularly high on their radars in terms of concerns about health and safety, and serve what we believe will be a body of, we'll have to expand that over time, but that will be a gradual process. Next slide. So the encampment assessments have scores on a variety of different factors. Most of those are objective. So is there presence of X or Y, for example, evidence of uncontrolled fire? Are there have people observed or known, are there known people in the encampment that are mobility impaired and utilize mobility aids, those kind of things. And then there are some subjective ratings that allow assessors to give their overall sense of the conditions in an encampment. Next slide. So this will be familiar to you. It is a slightly updated version of the criteria, some of the criteria that we showed last time. But just as a reminder, since we are focusing here on health and safety, we have some public health categories that really speak to both environmental health conditions and the physical or medical health status and access of occupants, along with public safety concerns, particularly around flood, wildfire, vehicular or transit dangers, et cetera, and the ability of first responders to access sites. Next slide. The potential scores for encampments range, based on the current tool, from 3 to, I believe, 35. And this shows the range of scores that resulted from the assessments that were done in the 11 encampments, ranging from 9 to almost 22. And so, we did see a good spread, which we felt like was important in terms of the tool having some utility for helping us understand encampments that we might want to target first. And assessors also indicated that they did feel like, generally speaking, the scores were pretty consistent with their sense of conditions in the encampments. But of course, we will be continuing to adjust the criteria or weighting as the tool is utilized, and we sort of identify any gaps or redundancies in the scoring. But based on this first phase, we are feeling pretty good about the tool as something that has utility for the teams. Next slide. So the next steps are to prepare for the intake and relocation of the next encampment, which will happen before Thanksgiving. And we will continue to do assessments based on referrals that we're getting both from departments and from the public. But one of the things we will need to do, particularly as we staff the program up, is to develop that process so that we have a workflow for identifying how we expand the circle of encampments that have been assessed, and how we go through the process in cross-departmental meetings of identifying which encampments we would target. I also want to point out that this is, of course, fluid. The HEAL initiative is about relocation to shelter and the offer of housing. Of course, enforcement is happening in the community outside of the HEAL initiative as well. And so even just in our first round of assessments, there were some encampments that had been on the radar for assessment for HEAL that had where enforcement had occurred and those encampments no longer existed. Because we know that in cases of enforcement, people are leaving sites, but they, of course, does not necessarily mean that their homelessness ends. And so we're also getting a lot of feedback from the public and many departments about new encampments or growth in encampments in other locations, which we expected based on the reality of having enforcement that is not always coupled with concrete access to shelter or housing. And then we are looking at continuing to develop the assessment tool to better incorporate GIS functionality in this next phase. That will be really, I think, a preliminary step. There is a lot we believe that could be done longer term, but we do want to make sure that some basic functionality is there in terms of GIS. Next slide. In terms of the service side of HEAL, on November 18th, Council will have an agenda item to expand an existing rapid rehousing contract with Family Elder Care by $1.5 million. And that will do two things. It will accommodate some individuals who are relocated through the phase 1 of HEAL, but for whom there was not immediately adequate case management capacity or rapid rehousing program capacity, I should say. And it will allow for some additional capacity for the initial encampments in phase 2. That is using general fund dollars because the original contract was general fund. It made most sense to do that with one-time general fund dollars. We will then do a solicitation for additional vendors with ARPA funds for additional rapid rehousing attached to the HEAL initiative, but need a little time, of course, to go through that solicitation process. We will be looking at our bridge shelter capacity. Of course, our ability to relocate encampments is dependent on the capacity within our bridge shelters. And so, we have 2 up and running right now. And, we are talking with the community about whether there are other alternatives for creating other temporary shelter options in the community that could expand our ability to relocate folks from encampments, but that is forthcoming. And then related to the HEAL initiative, although it is not limited to the HEAL initiative, we are launching a project with the Office of Performance Management that really looks at our workflows, our standard operating procedures, and our prioritization around encampment response generally. So, as we mentioned, we have a tool now that helps us prioritize encampments for HEAL. But we want to be engaged in a cross-departmental process and cross-disciplinary process, even when we look at encampments where there may need to be other interventions. Cleanup where APD may intend to enforce. How do we do that coordination across departments? And how do we take in the information from the public, synthesize that into an orderly process, knowing that there's quite a lot of fluidity in the community right now. And so we're excited about their support of the various departments in this work. And again, those processes and procedures that we develop will both support the HEAL initiative, the part of it that is about the engagement with the encampments, as well as our work in encampments and public space management generally. Next slide. At this point, I'll pause. This is, of course, the presentation that Dak has already provided, and I'm happy to take questions on ARPA or HEAL or anything else that you've got on your mind.
Thank you, Ms. Gray. Vice Chair.
Thank you so much for this presentation. It's incredibly helpful to have a better understanding of what the community is thinking about our efforts to address homelessness. I really appreciate the metrics that you provided, knowing that Austinites would like to receive monthly updates about what we're doing with our significant investment and how we're approaching our efforts to address homelessness hand in hand with the community is important. And I love that you even broke it down by wanting it via email and receiving updates on social media. And I appreciate your commitment to having quarterly updates. I think having that opportunity to have regular check-ins with the community would be super helpful. Do want to flag, I think many of us have newsletters that we send to our constituents. And so if there's ever an opportunity for us to include those updates in our own district level communications, I'd be more than happy to do that as well. Also, if one of those quarterly meetings is held in person, that would also be helpful too, because I know for communities like mine, really appreciate that in-person connectivity and want to have that type of interaction with their city leaders. And so my question is on the launch of the encampment project with the Office of Performance Management. Can you share a little bit more? I missed part of when you were explaining about what it'll be, but what can we expect with that partnership? Will that be a dashboard of where we can share out, how many PSH units we have online, or how many, individuals we've been able to connect to housing? Would be that type of format, or is this a different type of tracking mechanism?
Yes, Vice Chair. So this program, this initiative with OPM is actually much more narrowly focused on public space management. So, we have recognized that there has been a lot of amazing work being done across many departments around the cleanups and, outreach, et cetera, but that we had a somewhat fragmented system and some gaps in workflows and standard operating procedures across departments for this work. So we want to make sure that we create that infrastructure that really supports staff as they go about this work. And so among a variety of elements of the scope include really identifying the workflow. How do we make decisions about where our cleanup resources, where our outreach resources go, where, and even when, enforcement occurs, particularly if it's in the case of a larger encampment, and in addition to what we were talking about in this briefing, which is specifically how are we prioritizing HEAL, where we're explicitly connecting people to shelter and housing resources, which of course is our holy grail and what we'd like to be doing in all cases. And we'll be moving increasingly toward that. But really prioritization, standard operating procedures, kind of how the decision making occurs. And I think importantly, all of our departments get contacts from 311, sometimes funneled through council member offices from the community directly, and really, acknowledging all of that input and making sure that we have a way to synthesize it and then make decisions really that are based on good public policy, on equitable service across the city, and our best service also to our neighbors who are unhoused.
Thank you. That's super helpful. And last, just wanted to make a comment that I appreciated you sharing out the feedback that was received from the community, and then also sharing the adjustments that you made to the proposed spending framework as a result of that feedback. Oftentimes we provide these spaces and opportunities for folks to provide input and to have their say in how we operate as a city of Austin. And so it's always great for us to have these tidbits to share. Your voice matters because you participated in this forum. There were actual changes made to how we are doing our crisis response and how we're reducing homelessness. So I really appreciate you drawing attention to that change.
Thank you, Vice Chair.
Thank you. Councilmember Kitchen, do you have any questions?
Yes, I'll ask quickly. So I have two questions if there's time. The first question relates to HEAL. Thank you again very much for the successful work that you all have been doing on HEAL. It's very much appreciated. Can you tell me, so it sounds to me from what you presented that it's on track with the timeline that was anticipated. That's a yes, right?
Yes, council member. We expect to have our next relocation of an encampment before Thanksgiving.
Okay, and then the second thing is, I'm wanting to keep an eye on the number of shelter beds because, that could be something that slows things down. So it sounded to me like y'all are anticipating and are looking into additional beds. Is that correct?
So we have enough capacity certainly for the next encampment, and believe we will be good for the following one as we have some work happening in some rooms. But I think the question will be the $6 million that council gave us direction to set aside for HEAL from within the ARPA funds. I think that we have sufficient capacity within our current shelter, bridge shelters to do that. I will tell you that I think one of the things we're contemplating is potentially a more aggressive approach as well. That
Okay.
we could increase that 6 million and what it would, asking what it would take in terms of additional shelter resources, be that not necessarily just a new facility, but potentially even hotel vouchers under the right circumstances to be able to be more aggressive. And that's just analysis that is ongoing at present.
Okay, I'll just say one thing about this and then Chair, I know we're out of time, but I think I'm very glad to hear you say that, particularly in light of the conversation we just had about because of Prop B, some people that were living in encampments that would have been appropriate for HEAL have been dispersed. And that means those folks have not been connected to housing for the most likely. And so I think to the extent it's possible, accelerating even beyond what we had anticipated for the second phase of HEAL would be important and I'm happy to hear that y'all are in the process of analyzing, what's appropriate there. So thank you.
Yes, Councilmember.
Chair, I could ask a million questions, but I know we don't have time, so.
Yeah, I have a few, but I'm going to keep it.
Thank you very much, Diana.
Yeah, thanks so much, Councilmember Kitchen. I know we all have lots to talk about within this area, so thank you, Ms. Gray, for being here every month. I have a couple questions. I'm just going to leave it at 1, 2. Can you help update us on where, in terms of shelter capacity, where we are with regard to our congregate shelters? Are they continuing to use kind of the pandemic numbers in terms of capacity? Have they altered their capacity at any point? I know we've asked you that question a few times, and they were using pandemic capacity.
We are still at those levels, Chair. I do think particularly as we stay stable in stage 3, and certainly if we dip into stage 2 risk level, that's a conversation that we will have with our health authority and with our shelter providers. Of course, we don't own all of the shelters, but we are owners of a couple of them. And so that's certainly something that is on our radar as well. And fingers crossed that we continue to improve and could make that ask of our providers.
Yeah, thank you. And I know we all want to see that capacity increase. However, I just want to say, how much I appreciate the real care that you and our health authority and our shelter providers have taken throughout this pandemic. I was looking at some numbers from another city recently of the numbers of COVID cases they had within their congregate shelters, and they were really quite high. So I just, we don't often pause and really talk about the great successes we've had here in Austin. But all of these measures have helped save lives, so thank you.
Well, I appreciate that, and I definitely want to acknowledge the community-wide work of Austin Public Health in the pandemic response. We have a small part in it.
Yes, thank you.